St. Luke's is obviously a large organization. We continue to grow every year. We have 14 campuses and growing. We're a very complex organization as it relates to trying to move patients across our organization.
We're fortunate at St. Luke's to have our own internal EMS agency in St. Luke's Emergency Transport Services. And we deliver every level of ambulance care, basic life support, advanced life support, up to ground critical care transport. Take a lot of pride in that. We have a growing team. Even with our team, we still cannot handle all of the demand that we have for ambulance transport here at St. Luke's Network. So we do rely on community partners, other EMS agencies out in the footprint of St. Luke's to support those patient requests.
My team was receiving 25,000 phone calls per month. Over 5,000 transport requests per month to come in and out of our hospital network had to be facilitated by my team.
Our communication center can be very chaotic. A lot of phones ringing at once, not really being able to catch up with your work.
We always had plenty of barriers to discharge, particularly for complex patients, but one of them was transport. Getting appropriate transport, getting it when we needed it. A patient would be ready for discharge at 10 or 11 in the morning, and you might not be able to get anybody till 5 or 6 at night or even later, sometimes not till the next day.
It was very frustrating for the everyday St. Luke's employee that was trying to coordinate these transports.
Our SLUHN organization that takes care of all of our patient transportation was over peak capacity, and so our team was really looking at solutions to help solve those capacity issues. And we know we have to rely on our community, but how can we make our community more responsive? And that's where we really led to looking at a solution for Roundtrip.
In my career, I've implemented a lot of different electronic solutions. I would say this is probably one of the best that I've implemented.
We had a 58% reduction in our patients waiting for transport, and we had a 67% reduction in overnight stays.
Our phone call volume within our communication center has decreased by 86%.
Because of the way the system integrates with Epic, we have a lot more clinical information readily available to us that we didn't have before.
There's less risk for error in providing information over the phones.
With the implementation of Roundtrip and the integration with Zoll RescueNet, this has truly allowed us to streamline our work processes.
One thing that's really awesome about the Roundtrip Tiger Connect integration is that I can see exactly what's going on with the ride. So I book a ride on Roundtrip, and then maybe I've gone to a meeting or I've stepped away from my computer. I get a text that tells me exactly what time that ride will be there and the transport company that's coming.
They also get to see all the progress along the way, when that truck is physically en route, when it's transporting, and when that patient is finally at their destination. Another way that Roundtrip has helped us improve the quality is through the medical necessities. By having them at our fingertips and into a central database, we're now able to build the claims. We have clean claims, so it increases the success of reimbursement from payers.
Healthcare is a very stressful environment. When we're giving people tools that are effective, it really just makes their day so much easier.
They're now able to spend more time with patients, spend more time doing more necessary things.
If you really understand your numbers and your data, you can manage your resources more efficiently, and our SLETS, St. Luke's Emergency Transport Organization, has been able to do that with the support of Roundtrip.
Roundtrip has brought in such a stability to my department. The staff turnover is below 2%. The satisfaction that my staff have keeps them there long term.
It's been an incredible partnership. From the beginning, they led with a lot of empathy. They completely understood the challenges we had at St. Luke's, and they also understood what made us unique.
If you have a transportation organization or you're working with a lot of community partners and it's very complex, similar to an organization like St. Luke's, you want to use Roundtrip, because I don't know of any software platform that handles this situation in the unique way that Roundtrip has done it.
If you're struggling with transport, if you want your staff to work to the top of their license so that they're not doing things that are more clerical in nature, this would be a good solution for you.
We have an increase in our quantity of transport requests coming in. Month to month, it continues to increase. And yet our wait times are going down. How is that possible? It's been possible through Roundtrip. And we take that really seriously, and we're really fortunate to have this partnership.